but it's still here today. So they're willing to work on swine flu, bird flu. Why isn't that same energy behind HIV?
Well, you know, many of the biggest figures of infection you will find in developed countries, as in sub-Saharan Africa. And sometimes I think it is because the people that have been affected are living in poverty, and therefore they themselves are under-resourced. And also that many of the people that are affected have been women, and the voice has not been able to come through and really make that, you know, collective, effective rallying for change. And it's, although in the Western world we have so many NGOs and organizations, and many of them coming here in Washington, as we've seen, that have been fighting this fight for decades.
If they're poor, if they're living in a poor country, if they're a gay man, if they're a woman, yes, does that mean that the world thinks that you're not worth helping?
I think it means that people are disempowered and they're busy trying to survive, and they don't have the resources and the means and the access to the things that they need to really change. And they're there. And what we need to do is to give access, to change the societies and the responses so that people can have life-saving access, and also destigmatization. Did you know that 1 out of 3 pregnant women have HIV living in South Africa at the moment? Do they know these facts? Do they know that children have HIV? Do they know that mothers who have HIV can actually prevent the transmission of the disease through to those children? The things that are so important, they have gone away from the headlines. And so now we're in 2012, and many great advancements have taken place. Good things have happened. People have galvanized, people have worked together, they've committed themselves to activism and campaigning and making the changes that were necessary to get the drugs to people, to get the medication, to get the help, the support, the medical treatment, the systems. We're halfway towards seeing the eradication of the virus, to seeing those changes that we really need to see permanently and for good. But the problem is we're at a really crucial point because we have financial downturn, and if we see the lack of investment and the change, we will just reverse all the good things that have happened over the last 30 years.
You talk about the global response being at that halfway critical juncture. What's going to be the tipping point? Is it simply going to be more money and better investments? What's it going to take?
It takes several things, but I think still as a campaigner I would say pushing the message, telling people it's here, it's not gone away, and telling the facts and the scale of the thing, and having them understand that HIV and AIDS is actually about human rights.